Okay, first of all, I would like to thank Yoram and Yakir for inviting me to give this presentation. I got the most difficult role today, being the last speaker before dinner. So I'll just make it short. And the other thing is, in my first half of my presentation, I will present the principle, the engineering principle of this new lens. It was designed by the smart guys, the engineers. I'm just a cataract surgeon. So if you have any questions and more details, please ask the engineers. So this is a lens, it's called the Intensity. In a minute I'll show you why. And this is only part of the full range lenses. And it is designed by an algorithm which is called the Gershberg-Saxton algorithm combined with Hanita merit function. And it's altogether called the GSH kind of an algorithm. And the idea is, and they also use the Arizona eye model, which is very useful for these designs. And the idea was to create a lens which would provide the most efficient way to distribute the energy. So it maximizes the intensity of the eye, and most of the light will go to the foci that we would like them to go, and the least will be distributed as lights which are not effective. Now, this is the principle of how it works. To make things quite simplified, first the engineer decide on what kind of design. I wish it works. Okay. First, the engineer decide what kind of light distribution they want the lens to be. Then they make a run of this algorithm with inverse Fourier transform, and then it comes with some kind of a design of a lens, and this is the outcome of the first run. Now, if it is not exactly what they designed, they make a second round, which comes closer and closer, and then a third round, and so on, until it becomes similar more and more to what was the initial design or desired kind of lens. Now, for this specific lens, it required 66 rounds altogether until they received the exactly light distribution as they desired. This lens is a diffractive area which is quite large, 5.2. The aspheric diffractive is on the posterior surface, the anterior surface is spheric. Pupil optimized lens, and with a spherical aberration of minus 0.13 micron, 25% hydrophilic lens. And it also has a natural yellow blue blocker. Now, what are the lens foci? We know trifocal, the classical ones have the 0 IOL power, which provide the foci and at infinity. And then the intermediate, which will be 1.5 at the IOL plane, 1.25 at spectacle plane or corneal plane. That will be at about 80 centimeters. And then the near foci, which is going to be on the 3 diopters in the IOL plane, 2.5 in the spectacle plane at about 40 centimeters. But here, in addition, there are 2 more foci, which are the in between the far and intermediate, which is termed here far intensified. This is why it's called intensity lens. And another one which is in between the near and intermediate at the 2 diopters, which is about 60 centimeters. So as you see, 40, 60, and 80 centimeters different foci. Which actually means this is not a trifocal lens, this is a polyfocal lens, multiple focal lens at various foci from center. This is what the energy is distributed. And now, as you see here, the number 0 is here. This is the order of the lens. And let me just say just a word for those who are not familiar with diffractive optics. This is if you have 2 waves of light getting together, they cause what we call interference. And this is how the light is distributed to a different foci. So this first one is order 0, this is order 1, and this is order 2. When 2 waves of light meet together, if they are on the same phase, they intensify each other. If they are on a different phase, they actually distract each other. This is why we have light, and then black, and then white, light, and then dark, and then light and dark again. One other thing is that the 0 order is the strongest, then it's a little bit weaker, and then a little bit weaker. all diffractive lenses, those sort of bifocal and trifocal lenses, the order 0 is a distance, because this is the most important distance. And then it goes to intermediate and near, which means that the near is not as strong as the distance. And this is one problem that we have all with multifocal or trifocal lenses, that the patient, if you have 100% of light going into the eye, you cannot have 100% in each of the focus. Since the most important is the distance, patients complain they do not see well for the near. So this is why there was a need to redistribute the light in this lens. So as we can see here, the light distribution, the order 0 is the intermediate. And then the other foci is one is the infinity, which is the far, and the other one is the near. That means that light going for infinity, for distance, is quite strong and very satisfactory. But the most impressive part is this part, which is the near and the intermediate and the in-between, meaning that the intermediate and near light distribution is very effective in this specific lens with these 3 foci of far, intermediate, and near, and the 2 intensity here shown in red. Now this is what the lens looks like. Now this 0 here is the 0 distance from the center. So we have actually, we can see there's one design here, second design here, and the third design is here. It's called, these are the zones, different zone, and each zone has its own specific characteristics. This is zone 1, very close to the center, zone 2, the intermediate, and zone 3 at the far periphery of the lens. What it does, that's the one zone 1, which is close to the center, give the distance, the far intensity, and the near. Because when we read, we have also not only convergence, but in accommodation, we also have meiosis. So this is why we need a good vision in the center part when the pupil goes down. As the pupils goes laterally, then we see the light distribution is for far and more towards the intermediate and less for the near. So the near focus is very much intensified in the center of the lens. These are the 3 foci, the classical, far, intermediate, and near. But in addition, we have 2 more, which is the far intensified, but what's more important is the near intensified, which this is what I meant by having polyfoci or multifoci and not just 3 focal. It's the entire range. This is in comparison to the other lenses, such as the fine vision of Physiol, E.I.Asia of Zeiss, Panoptics of Alcon, as compared to the intensity of Hanitalens. And as we can see, 86% to 88% goes to the foci, and about 12 to 14 are lost. In the intensity, 92.5 goes to the desired foci, and 7.5 is lost. It doesn't look very impressive, but if you think of it, 14% is lost in these lenses, 1/2 is lost with the new lens. So in terms of how much light is lost, there is a decrease of 40% of light loss, and this is what caused the halos and the glare in these lenses. This is another way to show the difference between the different lenses. Again, the E.I.Asia, the fine vision, and Panoptics as compared to the intensity. And these red lines here show where the foci are good and effective. So for example, with the E.I.Asia, this is a 2 millimeter pupil, very small one. So with the E.I.Asia, it's effective from distance to intermediate. There is a gap here, and in the near vision. Fine vision, pretty much the same. Panoptics is stronger with the near to intermediate, and there is a gap in the center and less with a distance. As compared to that, the intensity is most of the range is covered except for a small range here, and this is at the 2 millimeter pupil. 3 millimeter pupil is even less, so it's effective for distance and for the intermediate, far intermediate, until the near, as compared to much larger gaps in the other lenses. And for the 4.5, the same. The other lenses, Panoptics, fine vision, E.I.Asia, it's more gaps, less accuracy in these ranges between the far and the intermediate, and also for the near. Whereas for the intensity, a wide range of focus can be achieved for most distances. And also the spread function test that we see, we compare the Panoptics with the intensity. There is a small halo here, so the intensity halo estimation is at least as good as Panoptics, if not better. Now, we did this clinical study. This is a very, very initial study. We just implanted the very first lenses. I think that so far we had about 5 patients, and we implanted in 9. So I'm going to show you the very, very first results. The idea was to investigate binocular and monocular visual acuity for all distances and to measure the defocus curves. Prospective, single arm, single center, so far, single surgeon, myself, and open labeled. And basically what it has, patients with between 45 and 75, normal lengths, stigmatism 0.75 and lower, and no other disease. So this is only the small numbers. I know this is not real big data, but just to show you the notion. These are the first results. This is a pre-op, most of them at average of almost emetropia, K1, K2 in the normal range, cylinder less than 0.75 in this eyes. And this is operation if it works. Yeah. And what is special in this operation, what we are going to see here, is there is nothing special. This is a very simple, very straightforward surgery. This is a classical design of the C-lens, and you do it just like we do any other C-lens. Very simple to implant. And we can see the diffractive circles which occupy a large portion of the lens once it is in the bag. Then actually this is it. It's quite a simple and straightforward operation. So nothing special, nothing new in this regard. Okay, let's proceed. Okay, the patient that we have spherical equivalent, we started with a little bit of myopia in the first 2 cases, so we had a feeling that we need to modify a little bit the A constant, but eventually it went down to almost negligible myopia. This is uncorrected distance intermediate and near vision. Vision for distant was 6.7.5, 6.9 for intermediate, but this is most interesting because the near vision was superb. And this is something that all patients repeatedly said that their near vision is good and no complaints on readings, which is quite exceptional for these trifocal lenses. The corrected visual acuity is 6.6, 6.9, and 6.5 for the near. And for both eyes open, then the results are even better, 6.6, 6.7.5, and better than the 6.6, 6.5 for the near vision. As for the defocus curve, the focus is around the 0. This is, better is up and worse is down. As for each individual eyes, we can see that the results were about 0, about almost emetropia. And what's interesting is that this is a flat curve, which means there is no distance, different focus for intermediate, near, intermediate, but this is kind of a flat curve all around, which is the ideal multifocal lens. And with both eyes open, it was 6.6 and better in most cases. These are the satisfaction questionnaire. And as we can see, patients were happy. Just for knitting, this is very demanding for reading, but they had no problem with the near vision as well. As for the visual phenomena, there was some glare, some halos, but it was only after we asked them specifically. If we asked, do you have any problem? No. Do you see any glare or halos? Yeah. If you're asking, then we can say we did feel some. But this was not any complaint. Still, this is not a big data. It's only just a few cases. Glass dependence, none of them had a need for distance, intermediate, or near vision. And as for satisfaction, they were happy, but as I mentioned again, this is only a few eyes. So altogether, this is a very promising lens design that does provide good depth of focus. I would like to emphasize once again the near vision, which is exceptional for this lens. They are quite happy, and we are now going to continue with this study, and hopefully next year we come with some more clinical results. Thank you.